Greg Nigh, and welcome back to the Deep Dive Podcast. And today uh, I'm gonna tackle the topic of ears and hearing, and um, with patients, one very common report is tinnitus, whatever. Um, and unfortunately, I'm not going to solve that problem on this podcast because that is a very difficult problem to solve. And I think it's a very big picture about what is driving tinnitus. And there has been a dramatic increase in the rise of the number of people who experience ringing in their ears over many decades. And I think in fact, this book, The Invisible Rainbow, I think does a very good job at explaining why that might be. It has to do with the increasingly dense presence of electromagnetic fields that are coming not just from, phones and computers and Wi-Fi, but electricity, all electricity. When we started wiring our world and running electricity through those wires that were all around, increasingly people started reporting ears ringing, but something new about it used to be when people had ringing in their ear, it was always associated with hearing loss. Now, with the wired world, people very commonly have ringing in their ear, but they don't have hearing loss. It's a very different thing. I think there's an electromagnetic component to it. I'll probably do another podcast on that itself because it's a fascinating topic. But in this one, I want to focus just specifically on beyond having any ringing in their ear, there are many people who experience just like a sense of fullness in their ears. And maybe you can hear fluid or almost like a sound, like a wind sound in their ear. And there's a very easy therapy that I want to just explain. Anybody can do it. I do it every day just because I've got a hearing issue, which, if you want to look at another podcast I did, you can all about my personal history around what happened with my hearing. But so let me start with this. There are many people who know that they get swollen lymph nodes, and you don't need a doctor to be able to tell if your lymph nodes are swollen. You can put your own fingers, you put this part of this middle finger, put these two fingers together. This part right here goes against the angle of your neck, right at the angle, so that your fingers lay then down right under your neck, and you just run them along the edge, along the bone edge, your chin. You just go gentle back and forth, and you feel little bumps under there. Some people, little bumps. Some people, they're big. They occupy big space and they're tender. Um, so keeping in mind, those are lymph nodes. They're just a kind of an accumulation of immune cells. They get big when there's something in the region that needs some immunological attention. So irritants come in, we get upper respiratory infection, maybe bacteria or viruses, and you need to call in the lymph cells so that they can, check it out and fight what needs to be fought. Also, people that have enlarged tonsils. Now, by my age, many of us had those taken out long ago, but fortunately, there are many people now who are not, who are reaching adulthood who did not have their tonsils taken out because it became known that it was really a bad idea. But people with chronically enlarged tonsils, or if you look back and you can see they kind of have a whiteness to them or even little white dots on them. People with that, very commonly, these lymph nodes are enlarged. And keep in mind, these nodes go up behind the ear. So, like in doing a physical exam, you want to feel up behind the ears, and it's not too uncommon. You can feel bumps back there. Those are just enlarged nodes, just like these get enlarged. These are dealing with something in this area, some kind of infection, but they come up in front of the ear and behind the ear. So it's a good thing to move lymph fluid, to try to keep pushing it through those nodes. The node is just like it's like a, it's a, what, like a tower in the middle of a wall. So the lymph comes in, there's the node, it drains into the node, and the lymph fluid interacts with billions of immune cells that are in there, kind of letting the immune cells check out what's there, and then it needs to move out of the node. The fluid then moves out of the node, and ultimately it drains into your blood vessel right here around your heart. So the fluid all ends up back in circulation. So it kind of goes, now it's going back out of the blood. The blood makes it all the way to the capillaries. Some of that fluid leaks out of the capillaries, and now it can then return into the lymphatic vessels, and the whole process continues. Okay, what I want to talk about: castor oil. So easy. So castor oil has all kinds of great uses. There are lots of resources out there to talk about the different ways you can use castor oil. In this particular instance, castor oil around the ears helps to move that fluid. So for people that have enlarged nodes, and or they have kind of just a feeling that their ears don't quite clear, that there's some kind of congestion or pressure or fluid in there, castor oil is an easy, cheap therapy every day. So the method is also very easy. So my bottle, and I pop it open. I'm not gonna do it right now, but maybe I will. um a little bit. It doesn't take much. This stuff is goopy, and your hands are going to be sticky when you're done. Not sticky, but that thick, goopy kind of oil. So you're going to have to wash your hands as soon as you're done. So just a little dab will do you. On here, how would I describe that? It's probably like a quarter of a teaspoon ish, around there. Yeah, probably quarter of a teaspoon, quarter to a half. Okay, so there, and then I'm I just smear it in one long smear right along my chin bone, so that I'm just covering up all these lymph nodes that are right here. So then I also, will massage it up behind my ear, a little bit in front, and just work it into my skin over here. And then same thing over here, and drag it along the chin line, making sure to cover these nodes that hang out right under here, and then massage it up behind my ear. Easy peasy. So for me, I'm actually doing this 3 times a day. I do this. It's just my routine. Not that you need to know it, but whatever. When I get up in the morning, I that's when I do a lot of my work. And so as soon as I'm sitting down at this computer, it goes on. I do work for a while, then whatever, I do my workout. That's about a 2 hour process. And after that, okay, shower, done. Now I've wiped it all off, so I reapply. And then I have usually an afternoon work session that goes, and then whatever. That takes me through until bedtime. And by bedtime, it's like I can tell there's not really much there anymore because it's all seeped in. It's through the skin, that's what I want. So I do another application right before bed. Now, okay, your wrist, maybe you're going to get a little bit of stain on your pillow sheet or other sheets. So maybe put a towel down if you're worried about that. But so for me, I'm getting an application 3 times because when I started doing it, and I'll tell you, I started this. Uh, I mean, this has been maybe a month that I've been doing it consistently. And I can tell. I mean, I'm very tuned in to how I'm hearing because, well, I'm deaf in this ear. Read about it in the other podcast. Um, So I only have hearing in this ear, and I'm very tuned in when there are slight variations in how I'm hearing in that ear. And there are reasons that that happens. But so I thought, what the hell? I'll just start putting this on there on a consistent basis and see what happens. And it was really within a few days that I could say, oh, yeah, I'm hearing better in my left ear. So that's one thing you can do. Another addition to that you might consider. So there are these lymph nodes, we said, all around. They run behind the ear, they run up the front of the ear, it drains down under the ear, and then there are also nodes that end up on the scalp. So you're essentially doing a stretching exercise with your ear. So, and this, a couple times a day, there is pulling down and just like traction down for about 4 or 5 seconds. And then you're grabbing the back and you pull it back toward the back of your head, 4 or 5 seconds. Pull it up, 4 or 5 seconds, and then you're just pushing on this, this flap here, the tragus. You're pushing forward to just kind of compress the nodes all the way around the ear. And it really doesn't take long. You just, be even 2 or 3 seconds. You're just trying to get some action in the nodes. You're trying to move that fluid because keep in mind, in the lymph system, there's no heart that pushes any of that fluid through. It only gets pushed through because we move, essentially. And your ears don't do a lot of moving. So help that along. Then the one last kind of move that is very helpful, I think, is starting at the base of the ear and just drag forward because that's the direction that fluid is moving. It encourages it to come down in the front of the neck, empty into the place here, and back into circulation. So, and once there's a layer of castor oil on there, it's kind of an easy glide. Um, but then, 3 or 4 or 5, just slow rolling over those nodes. You got to be as light as you need to be so it's not painful, but you do want to just put some gentle pressure on them because they're like sponges and you're just squeezing the sponge because it will push it along the pathway. So, all right, easy therapy for people that have a little congestion in their ears, castor oil, just a dab, boom, boom, a couple times a day. Do some front, and some of this. It helped to move that fluid out. It will improve your immune system up here, but ultimately, if you do have chronically enlarged, especially tonsils or lymph nodes, you got to figure out what is annoying your immune system. And it's almost always going to be in your diet. That's, a more involved process to figure that out. But in the meantime, this is a great way to kind of help relieve some congestion. So, hope that was helpful. If you liked it, please do subscribe. It helps me out. I don't like to ask people stuff like that, but hit the subscribe or like, however that works. I don't even know. But like and subscribe, that's what everybody says. Um, and feel free to leave a comment, and I will be back soon with another edition. See you soon.